Good evening. It is the big question of our time. How can London fight back against the knife crime epidemic? Today, the boss of the Met Police left the capital and headed to Glasgow, a city which has seen a remarkable recent downturn in the number of stabbings, with no reports of any in the last 7 years. That figure stands in stark contrast to what London has endured this year alone: 16 knife-related deaths, and we're only in the second month of 2018. So, what lessons can Cressida Dick learn to ensure number 17 isn't just another statistic? Well, Ria Chatterjee is in Glasgow for us this evening. Ria.
Well, Glasgow used to be known as the murder capital of Western Europe, and in the last 10 years or so, they've massively turned things round, and we'll have some more facts and figures for you on that in the next few minutes. But it's no surprise then that the head of the Met Police was here today basically looking for some advice, because it has been a terrible week for London in terms of knife crime. Booze and blade culture. That was the buzz phrase when things were really bad here. A decade ago, some 10,000 people were carrying knives all over Scotland. In 2015, that figure was down to 3,000. So what's changed? The charity Medics Against Violence works in schools in Scotland, educating youngsters from an early age.
If we can help people to navigate their way through adolescence safely and come up with the right way to approach life as adults, then they're going to pass that on and we'll continue to have a safer, happier society.
And what about the Violence Reduction Unit then? How have they changed things in Scotland?
The Violence Reduction Unit have been inclusive. They've been willing to listen to everyone who's got a stake in this, and ultimately the whole public has a stake in this.
The Violence Reduction Unit was set up in 2005, determined to tackle the city's seeming addiction to violence. Mentorship and training is key to the way they work. The strategy here in Glasgow started out with a dramatic intervention. Nearly 100 of the city's gang members, those most likely to offend, were invited to the sheriff's court. There, they were first shown pictures of themselves and given a warning. Next, they heard from a mother who'd lost her son to knife crime. And finally, they were given a phone number and told, "Ring us if you need help." The Met Police Commissioner, Cressida Dick, thinks it's time to call London's problem a public health crisis, tackle it like an illness. Today, she met Scottish colleagues. When you were Deputy Borough Commander in Hackney, what did you do?
Well, I had my Safer Neighbour teams.
Leroy Logan was at today's conference, and he knows a thing or two about policing in London. For 3 years, he accompanied his teams on the streets to improve tense relationships.
It's a terrible start to New Year, and we really need to understand that we need to be working with young people. They need to be the centre of all our tactics in terms of problem solving and prevention. They're over-policed and under-protected, and unfortunately not talking to police, and these stabbings are going on without police having an idea when the next one is going to happen.
Many say London can't arrest its way out of this problem. Ria Chatterjee, ITV News.
So why is the head of the Met Police looking to Scotland's second city for ways to tackle knife crime? Well, between 2006 and 2011, 15 people under 19 were stabbed to death in Glasgow. Since 2012, there have been none. And over a 10-year period, the number of people found carrying a knife or blade in Scotland fell by 69%. Well, here to discuss the issue is former Met Chief Inspector Peter Kirkham. Peter, thank you for coming in to talk to me about this. I mean, you just saw Ria's report there. You just heard those statistics. What is Glasgow getting so right and we are getting so wrong?
The whole point of treating it as a public health issue is that you look for the causes and don't just treat the symptoms. Policing can only treat the symptoms.
Okay.
Policing is what's going to happen if somebody carries a knife, decides to carry a knife out on the street. Then policing's the sort of last opportunity to stop them using it. And that needs to be there. People seem to be thinking that the public health approach is not policing. It isn't. Policing is an integral part of that. They did more policing and more stop search at the beginning to show that the stick was there as well as the carrot. But it gets into the reasons why people decide to carry the knife in the first place, which police really can't do.
OK, so we saw there in Ria's report this inclusive approach, that it is something you can't simply police your way out of. How do we build those bridges, though, between police officers that here in London and the young people who are carrying knives on a daily basis and unfortunately committing these crimes and killing each other?
They simply won't listen to the police. Kids don't listen to the police full stop about anything.
But why is that? How can we work on that? What can we do?
It's not that. What we need is other people that do have influence with young people. So youth leaders, teachers, community groups, mentoring, you heard mentioned there. There's a whole range of interventions by other people apart from police officers that need to be taking that message. And unfortunately, that isn't necessarily there all the time. There's some really good people operating in those spheres, but it's capacity. And the second big point is this doesn't happen for nothing. Amber Rudd recently has said, oh, well, this can all be done out of existing budgets. No, it can't.
You're saying it's a budgetary issue, saying it's a resourcing issue?
There is money needed, not massive amounts, not the sorts of money they spend on bribing the DUP to support them and other things, but they need significant additional money. And most importantly, they need leadership from the government. Within London, the mayor is trying to get something off the ground, and within London, that's great. But it's bigger than London, especially with the county lines drug issues, taking London problems out into the home counties and further. But I mean, recently there was stabbings in Horsham, there's stabbings in Sleepy Little Village in Hertfordshire. This is not just a London problem, so it needs government lead.
All right, well, Peter Kirkham, thank you so much for coming in to talk to me about this today. Thank you. Well, this week our focus has been on knife crime after 3 fatal stabbings in the capital since the weekend. And while Cressida Dick was in Glasgow today looking for answers, her officers back here reveal they now believe 2 of the attacks in Camden are linked. Well, from there, Lorna Shaddock has the latest.
The investigation goes on, but now the police think the 3 stabbings here on Tuesday night weren't separate crimes. They say there's one key piece of evidence linking them.
There's a blue van that was seen near the first murder in Bartholomew Road at 8:30 in the evening, and then seen in Malden Road at 10:13 p.m. for the second murder for the 20-year-old. The van was found burnt out.
But there's also one thing linking the victims. They were all Somali.
To be honest,
at one mosque, a stone's throw from the scene of the 3rd stabbing, worshippers are feeling vulnerable.
Being a Somali, that's where the target is now. Some of the gangsters, they do something outside Camden, and people will retaliate. And that retaliation comes not exactly the people who commit the crime. It comes to anyone who is Somali. So would I be the next? My son or my daughter? God knows.
well, welcome.
Mohammed's oldest child is 18, the youngest just 7. He wants to hear more reassurance from the local police.
In terms of the police, we don't exist for that. Before incident happens, if we involve and the police notify us and contact us as a parent, we can set up parent forum which deals with the issues when they are at the bottom, not when the incident happens.
Others say the growing community does face its own challenges.
Families are traumatic still. They have still the trauma of the civil war.
The problem of Somalia, the destruction, all it has got impact to what we have here. So we are a little bit divided. So I think.
Just a few days on from the tragic stabbings here in Camden, a real sense of shock among the Somali community, but also of isolation and a feeling that things need to change in the relations between the community and the police. Lorna Shaddock, ITV News.
Well, back now to Ria in Glasgow. Ria, you were in Camden on Wednesday morning. You witnessed firsthand the shock and the grief of the community there. What's been your take on events in Scotland today?
Well, it's interesting because a lot of the people that I've spoken to over the last week, particularly on the Peckwater estate, have spoken about a lot of the strategies that Scotland has adopted. And I'm talking about 17 and 18-year-olds who are coming up with ideas like there needs to be more youth engagement, there needs to be earlier education, there needs to be more opportunities and aspiration available for teenagers. And obviously they don't have the power to create this change. So they're looking to people like Cressida Dick, Sadiq Khan, Theresa May, Amber Rudd, all these names have come up to implement the change. So I think there'll be a lot of communities across London who are affected by knife crime who will be watching and waiting. Lucrezia.
Indeed. Ria Chatterjee in Glasgow, many thanks.